Good afternoon. As you know, Thailand is the land of smiles, and the country with the highest rate of motorbike accidents, and over 70% of those result in some type of facial or dental trauma. How can people have the confidence to smile if their teeth look like this? Would you want to smile if you lost your front teeth? Dental implants may seem like the obvious solution. However, for growing patients, these implants are contraindicated. The implant fuses with the bone and doesn't develop with the patient, ultimately leading to the implant failing. So, what's the alternative? Well, the best alternative is already in the patient's mouth. It's their own teeth that can replace the missing one. It's called an autogenous tooth transplantation. So, the procedure is notoriously difficult and technically demanding. Success depends on many factors, including the surgeon's ability to plan ahead and quickly solve a complex puzzle during surgery. Every second the donor tooth is outside the mouth, its chances of survival drops. So, this is where my project comes in, an AI-powered fully guided protocol for tooth auto-transplantation. It can be added to the current system to increase the efficiency, which right now, the process is to position the tooth manually within the software. Not only will this make the surgeon's job easier, but it will also reduce the amount of time the tooth is exposed to air, which minimizes risk and trauma. My objective is to develop a novel AI-powered digital protocol for fully guided tooth auto-transplantation to assist in treatment planning and surgical procedure. And it's also to conduct a comparative clinical study evaluating the efficiency of this AI-guided method and the conventional technique for mature premolar tooth auto-transplantation within the aesthetic zones. So, how does it work? The CBCT scan would be combined with the intraoral scan to create a visualization of the recipient site and the donor tooth. The AI would analyze the volume and density of the root, identifying collision points of the bone and calculating the ideal insertion path. Then the surgical guide can be printed according to the AI's planning. To validate this protocol, the next step is the clinical study. The proposed study would compare the new AI-guided method to the conventional technique, with primary metrics being surgical time, extraoral time, and success rates. Now, a key challenge for this project is the same faced by any AI system in medicine: the need for a large amount of data and cases to train the AI to become incredibly precise and reliable. This requires it to learn from a significantly large and diverse data set of CBCT scans, which all have to be annotated so the AI know what to look for. Currently, surgeons have to navigate a complex software program to manually measure and plan. It demands a high level of training and expertise, which limits which patients can get care and when. This project is about turning a complex procedure into a reliable one. By using AI and digital guides, we can make auto-transplantation safer, faster, and much more predictable. Most importantly, because it's the patient's own teeth, it's more affordable. This isn't just better technology, it's a chance to make best care accessible so everyone has the confidence to smile. These are my references. Oh. Thank you.
네, 질문이 있으신 교수님들께서는 거수해 주시기 바랍니다.
Thank you very much. So, why do you call this as auto-transplantation? What is automating?
Auto-transplantation is, the word auto comes from like surgery that is within the body. So like you take one part of your body and put it somewhere else, and it's a transplant.
Oh, that means that auto is self?
Yeah.
You mean self? Okay, I see. Thank you.
네, 다른 질문이 없으면 발표를 마치도록 하겠습니다. เรียบร้อยนะครับ